one of the leading chains in ophthalmology in India. And today what we have is we have 82 centers, and most of our centers are NABH fully accredited, and we are present in 15 states and union territories. That is where center site is. And you can see our spread starts from Jammu and Kashmir, and we go right up to Assam. We have in Siliguri, we have in Calcutta, we have in Bhubaneswar, so east, and then we go down up to Andhra and Telangana. So these are our centers. Only somehow Chhattisgarh is left, and we are not there in South India. So these are the areas where we are, and we have close to 350 doctors who are associated with Center for Sight. So that's a huge number of people who are associated, and we see more than 1 million patients annually. And we are in this particular year we are looking at doing about 1 lakh surgeries, ophthalmic surgeries in the entire CFS horizon that we have. Now, we have the pan-India play, as I told you, with the robust eye care ecosystem. So basically, we treat right from the beginning, right from what a person wants or a child needs, from right up to what an elder person needs, from whether it's be cataract or diabetic retinopathy or macular degeneration, laser vision correction, whatever a person needs in eye care, we are proud to say that we are able to provide that. We have the most well-established eye cancer facility in Hyderabad, wherein we have also collaborated in developing local ruthenium plaque therapy for ocular tumors like retinoblastoma, etc. These plaques we were requiring to import for about 10 lakh rupees, and the price with Baba Atomic has now reduced to about 50 to 60,000. So we have participated in a lot of research and cutting edge technology, and we have a strong leadership with corporate governance standards. We have had multiple investments by private equity. So we had 2 rounds of investment by Matrix Partners. Then came in Mahindra, and now we have Chris Capital as our investor. So we have had 4 rounds of investment within us, and the corporate governance standards are good. And we have differentiated marketing and patient engagement strategies which are there with significant enhancement, enhancing brand presence and effective patient sources by investment on digital activities. So this is just to give you an overview that ophthalmology today is not eye just. Within ophthalmology, there are more than a dozen super specializations which are there, and this needs further super specialization. So we are proud to say that we have covered all the super specializations that are required, right from the pediatric ophthalmology, you have the refractive surgery, you have pediatric ophthalmology, squint, etc., ocular prosthesis, neuro. So we do corneal transplants. We are HOTA certified at various places which is there. In addition, we also have the pharma and opticals. These are 2 ancillary things that a person while going out would want medicines for eye, as also get their glasses or contact lenses. So this is the total plethora that we have of the things, and these are apart from a lot of Indian equipment, these are technologies which we possess. So you can see we are, as a group, the most penetrated as regards multiple great technologies that are there across our centers pan-India, so that the patients get the best of eye care at the best of reasonable prices that are there. So this is something that Center for Sight is really, so we believe in talent, having the best doctors, we believe in technology, and we believe in getting the trust of the patients for us. These are again just the refractive machines that is to remove glasses. As you all know, this is something which is gaining a lot of ground. So we are leaders and pioneers in refractive surgery, which is there. We also have pioneered the induction of femto cataracts, that is the blade-free cataract surgery, which is gaining a lot of traction, and we have about 9-10 machines. Lakshmi also has that machine. So we are doing the lot of femto cataract surgeries, And these are a couple of many firsts that we have and the recognitions that we have. So the first monofocal plus toric implant, first silk globally was done by us. Eye stents for glaucoma, LASIK, Alita, NGOCT. These are a couple of awards. Even yesterday we got the Times Healthcare Award. And if you look at our doctors, a lot of them have been ex-faculty, either at AIMS or LVP or even Shankar Netralaya. They have been trained at Shankara, etc. All these places. We ourselves run DNB programs wherein we take patients, doctors for doing DNB and fellowships. So we are significantly and research. We have over 50 publications last year in peer-reviewed journals. So basically, academics, research, clinical, everything is that is being done in Center for Sight. Let's come on to the average doctor experience. So our average doctor experience is 14 plus years. Though we have people who are in the 60s or 65, 67, but the average is pretty high, which is the leading in the industry. And the medical directors that we have who actually run particular centers, their average experience would be 31 years. We have 3 Padma awardees within our horizon of Center for Sight, and our attrition rate as regards doctor is less than 2%. So we have doctors who have been with us for more than 20, 25 years. The Center for Sight was established in 1996. Just to say that the leadership, we have the various positions which are there, CFO, ex Benetton, we have Ajay Dogra who is ex Fortis, etc. Stuti, she is again ex AHH and Fortis. So we have a strong management team, and also, as I told you, we have significant governance and we have lot of digitization. So Microsoft D365, Care Expert, Accent, etc., etc. So all of these talk to themselves, so that in the complexity of healthcare today, we are able to actually have a seamless transition from whether it is the patient to going on to the financial to the admin world. Sorry.